Did you know that if you have concussion symptoms past 7 to 14 days, it might not be an issue anymore with your brain, it might be an issue with your neck? This is something almost nobody talks about, but it could change your recovery. So PCS, Post Concussion Syndrome, is where things linger like headaches and lightheadedness and dizziness, vertigo, fatigue. These things are related to that post-concussion syndrome, and some people feel like they never recover from the concussion. But here's what often goes overlooked. The force that it takes to get a concussion often, most of the time, cause a neck injury, especially an upper neck injury. The top two bones and the head here, where all of this comes together, it's right where the area where the brainstem is. And a misalignment and injury in this area can really affect the neurological input into the brain. It can affect the what's called mechanoreceptors in your spine, telling your brain where your body is. It can affect blood flow into your brain. It can affect what's called cerebral spinal fluid into your brain. Now, if there's an issue with any of these, this can cause a feeling of lightheadedness, dizziness, headaches, migraines, all kinds of things can happen from an injury like this. So if those bones are misaligned, the nervous system and the body can't function the way that they're supposed to. This is why it's highly advised to get evaluated by a doctor who specializes in the upper cervical spine, specifically a chiropractor who analyzes the upper cervical spine. You want somebody who's looking at that every day, all day, and knows how to evaluate if there's a problem there. A lot of times other providers can take a look and do a quick exam and come to the conclusion that there's not a problem with the upper neck, when oftentimes we do find the exact problem when we can do x-rays and an exam to really figure out if there's that misalignment, correct it, and see the patient get better. In my office, we do a technique called NUCA. It's very, very specific to the upper neck, very gentle, very precise analysis and adjustment. And when the neck gets back into balance, a lot of patients feel improvement. They see their body functioning better. They start to restore normal health. So if you or someone you love is struggling from post-concussion syndrome, you've had a concussion, longer than 7 to 14 days, and it's just not getting better, make sure you see me or a doctor like me. We can really help out. This may be the missing piece to your recovery. If you have any questions, you can contact me through my website, or you can leave a comment below if this is on social media, where you can leave comments and I'll do my best to answer.